So welcome to mini lecture 5.3. This time we're going to cover basic principles related to addiction and drug tolerance. So what is drug tolerance? Well, if you take a drug for an extended period of time, you take it over and over and over again, eventually the response that you have is going to decrease. So a decreased response with extended exposure to a drug is called tolerance. It's when you build up tolerance. And there's actually different kinds of tolerance. There's metabolic tolerance, when the cells in your body develop, become more efficient in the way that they process a drug. There's cellular tolerance, where individual cells can adjust what they do to better manage the impact of a drug. There's also behavioral tolerance or learned tolerance. It's when people who have used a drug repeatedly find ways to cope or manage with the consequences of their drug use. There's a chart in the upper right-hand corner that's a tolerance chart. The vertical axis shows you the magnitude of the effect of a drug. So the top of the axis is a really strong impact of the drug, and down below is a small effect for the drug. And along the horizontal axis is how big of a dose you require. Now the top curve shows a drug response curve for someone taking a particular drug the first time. Okay, the more they take of a particular drug, the stronger the effect of that drug. But there's a second curve down below it. That is the difference between those two curves is tolerance. The lower curve shows how someone, the impact of a drug after it's been taken repeatedly. So you can see with tolerance, someone has to take more of the drug to get the same effect. Here is a classic study that's really old now, 1950s, where they got volunteers from prison for 3 months to drink enough alcohol every day to become intoxicated. And for the first 2 weeks-ish, that people were drinking the alcohol every day, enough to become intoxicated, they would become intoxicated as they drank the amount of alcohol that they had been assigned. But after about 2 weeks, the amount of alcohol that they consumed had less of an impact on two things: how intoxicated they appeared, so how much their speech slurred or they had trouble walking, but also the blood alcohol content, right? So the change, the lowering of the blood alcohol content tells you that the body has figured out a way to metabolize the drug, the alcohol in this case, more efficiently, so that the amount of alcohol that's in the blood is actually decreased. So that's a classic example of tolerance. You may have heard of the terms substance abuse and substance dependence or addiction. We say that someone is abusing a drug if they take too much of the drug and they're chronic. They do it a lot, and the drug starts to occupy a really important role in their life, right? When are they going to get the next drink? Substance dependence is when you become physically dependent on the drug such that you have to take it in order to feel and behave normally. You can only function, drug dependence is when you can only function with the drug in your system. You have to typically increase the dose, the amount of the drug that you've taken, because you're building up tolerance. And the key phrase for defining addiction or substance dependence, that key phrase is the one near the bottom that I have in italics there, where it says compulsive behavior despite negative consequences. That's when you really know you're dealing with addiction. People keep doing They keep going for the alcohol or the drug, even though they're experiencing negative consequences, losing relationships, losing their jobs, losing their housing. Their health is being compromised. They keep taking the drug, even though the consequences are harmful, are negative. On the bottom is a chart that surprises people. It's data that I took from a study published by the National Academy of Sciences, in which the scientists calculated the odds of becoming addicted to a drug after trying it. So about 9% of people become addicted to marijuana, THC, after they try it. Alcohol, it's a little higher, 15%. The highest, the most addictive drug is nicotine. So tobacco is extremely addictive. A third of the people who try tobacco become addicted to the nicotine. The American Psychiatric Association writes a book, and they update it regularly, that lists all of the different disorders and psychological problems and defines the criteria for each of them. So this is called the DSM, the Diagnostic and Statistical Manual. And according to the DSM, you need to have someone is considered to be addicted or dependent on a drug if they have at least 3 of the phenomena that are listed here. So if they develop tolerance, they just develop withdrawal symptoms, which is what happens to you when you stop taking the drug. If you constantly need the drug, if you spend a huge amount of your life trying to get the drug or use the drug or recover from the drug, if you start giving up important social and economic activities in order to get the drug. So you need 3 of those within a year's time. Withdrawal. If someone becomes addicted to a drug, they've gotten to the point where their body needs a drug for them to function normally. So when you take the drug away, when you try to withdraw from the drug, your body's not too thrilled with it. There are some negative physical and psychological consequences of stopping that drug intake. Symptoms can include everything from muscle cramping and vomiting and diarrhea, sweating, anxiety attacks, to convulsions and seizures. The time course for these withdrawal effects depend on the drug. So, for example, those of you who are addicted to caffeine, you can usually go, maybe you have to have your morning coffee, but then you can go almost, 22 hours before you need it again. For people who have become addicted to alcohol or morphine, the withdrawal symptoms can appear within hours of the last injection, the last time they took the drugs. I want to talk to you a little bit about one of the many kinds of addiction, but a kind of addiction that's really causing problems in the U.S. now. So we have a heroin epidemic that's now turning into a fentanyl epidemic. But heroin is one of many different types of opiates. And opiates stimulate the endorphin system, which we'll talk about in a minute, or actually in a subsequent mini lecture. They also increase the release of dopamine, which is associated with a reward mechanism that makes people feel good. In the last dozen years, the use of heroin has increased 500%. That's 5 times. Crazy. Where did this come from? Well, in the not so recent past, drug companies that started producing opiates as a pain relief mechanism, and they told doctors that the opiates that they were making available to them to use with their patients, opiates like OxyContin and the codeines, that the drug companies told the doctors that those medications were not addictive. Well, it turns out they were highly addictive. So doctors, thinking that these medications were not addictive, wrote prescriptions for them all the time. Somebody came in with a pain problem. Here's a script for opiates, 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 opiates. Then their patients started becoming addicted, and or the drug companies, with a little pressure, started becoming more open about the addictive aspects of their medications. And so doctors stopped prescribing the opiates so much. Well, you had a number of people who had become addicted to the opiates. Now they can't get them from their doctors anymore. Where are they going to get it? Well, heroin can be purchased on the street. It's an illegal drug that's available on the street. And it is actually more effective than the kinds of opiates that doctors had been prescribing, like Vicodin and OxyContin and Percocet. By taking heroin, it solved the tolerance buildup problem, because now people who had developed a tolerance for prescription pain relievers were now able to get the same pain relief that they had gotten before with a stronger drug, heroin. Then people took heroin for a while and built up a tolerance to that. Now the heroin is not helping them to manage their pain. So now what are they going to do? Well, maybe they started out with pills when they were taking Vicodin, and then they moved over to the heroin. Now they're injecting. It's still not enough. Well, there's a new drug out. It's even cheaper than heroin, unfortunately, it turns out. Fentanyl. Fentanyl is a synthetic opiate that's 50 times stronger than heroin, 50 times stronger than heroin, and 100 times stronger than morphine. Fentanyl was created for pain management during surgery, when somebody is cutting you open with a knife. So it's exceedingly strong. Because it is so strong, and because it's relatively inexpensive, it's very easy to overdose in fentanyl. And overdose rates for fentanyl have jumped dramatically in the last 20 years, which you can see from this curve for the CDC. This is a number of deaths per 100,000. And you could see that as heroin started flattening out on the yellow line, fentanyl is skyrocketing. Those are some basic concepts around psychoactive drugs. Come back in the next mini lecture. We're going to start psychoactive drugs. Start not taking them, talking about them. See you in a minute. Bye-bye.